Have you ever spent time in a hospital and been treated so well by a nurse that you forget you're in a hospital? Have you ever been treated so poorly that the injury just seems to get worse? The mean score of children's perceptions of their overall experience of hospitalization was 3.96. This is very low. As someone who is very accident prone and has a bad immune system, I have spent quite a long time in a hospital setting. I've had both good and bad experiences with nurses and doctors. The way a nurse interacts with children has a major impact on how the visit goes. Pediatric nurses provide care to all children and adolescents. Most pediatric nurses have their 4-year Bachelor's of Science in Nursing degree, which is their BSN. They will take the NCLEX at the end of 4 years to earn their registered nurse, which is their RN. So they will spend their college years taking the nursing program. They often have their Certified Nursing Assistant CNA certification that allows them to get experience in a medical field and often allows them to get an in with a local hospital or doctor's office. This means it is very easy to get a job afterwards. A pediatric nurse can also earn a pediatric nursing certification. This allows them to earn a higher salary and advance faster in their career. With this certification, they have more education and are also better equipped to handle certain situations that may arise. Since the patients are under 18 years of age, this means a lot of time the nurses are dealing with making sure the parents or guardians know what is happening and can comfort them as well. Pediatric nurses deal not only with the child in pain and discomfort, but also the parents or guardians. Since they are not legally an adult yet, this means that the major focus of their time is spent calming the parents of the child while also trying to comfort the child. While children are the main focus of the visit, it is important to realize that the parents are often just as scared as to what will happen to their child. The parents will be the ones making the decisions, and it is best to give them the options of care that can be done. If the patient wants something but the parents do not wish for it to be done, the parents' wishes are granted. Pediatric nurses use what is called family-centered care. This is a decision-making for healthcare. It is characterized by a partnership between the patient's family and the healthcare professional, as well as respect and dignity for the patient's cultural background, values, and beliefs. This is from an Exploring the Influences of Nursing Partnership with Parents, Attitudes of Families, Importance in Nursing Care and Professional Self-Efficiency on Quality of Pediatric Nursing Care, a path model written by So-Young Yo and Hurian Cho in July 29th, 2020. This shows that the children are not the only ones involved in the care and that parents have a right to know and choose what is best for their child. It also shows that the beliefs and values are taken into consideration always. If a certain religion or culture is believed, then those values are then put into play in the care of the patient, just like they would in an adult. But this time, it is what the parent says. While the parents are a big factor of the care, the child is ultimately the one that matters the most, and it is important to realize that they are scared and need to be taken care of. The nurse must understand that the child is most likely really nervous and scared about what is going to happen to them. This means that they must take care of their mental needs as well as their physical needs. Nurses have found that the familiarity and routines have been proven to create a more positive perception on the hospital stay of a kid. This is from Nurses' Perceptions of a Novel Health Information Technology, a qualitative study in the Pediatric Intensive Care Unit, written for the International Journal of Human Computer Interactions. It was written by Onur Asan, Catherine E. Flynn, Layla Azam, and Matthew C. Scanlon in 2017. The nicer the nurse is, the better stay for the kid it is. If the nurse does her job and spends no time making the kid feel safe or comfortable, then the kid will likely not trust as much and will not recover as fast. This is also true if the nurse takes the time to get to know the kid and allows herself to form a routine with them that they will feel safer and heal quicker. Researchers have found that the better experiences with the nurses involved in the case, the better the child reacts to the treatment. A truly good nurse knows the medicine and how to take care of the people and make them feel comfortable in their situation. In almost all cases, a child has come back and said that the nurse that they dealt with had a major impact on their whole experience. If they did not talk to them and only did the procedure, then the child said that they negatively affected their time. Nurses have a huge impact on the experiences of children as well as the parents' emotional support during the time in the hospital or doctor's office. When dealing with children, nurses must take into account the parents' emotions and beliefs of their children. Next time you're in a doctor's office or hospital, see how the nurses are towards you, and if possible, see if they act the same with the other patients around you.